How does OA affect your joint mobility and range of motion? Imagine trying to move your joints smoothly, only to feel stiffness and pain holding you back. That's what happens when osteoarthritis starts to affect your joints. Osteoarthritis, or OA, is a common condition that wears down the protective cartilage at the ends of your bones. When this cartilage breaks down, bones can rub against each other, causing pain and swelling. This friction makes moving the joint uncomfortable and often painful. As a result, your joint doesn't move as freely as it used to. You might notice that simple activities like bending your knees or reaching for something become harder. Pain is a big factor in limiting movement. It tends to get worse when you are active, but stiffness often hits after you've been sitting or lying down for a while. That stiffness can make your joints feel tight and hard to move. Because of this discomfort, many people start to avoid moving their joints as much as possible. This reduced activity can make the muscles around the joint weaker and smaller. When muscles weaken, they can't support the joint as well, which makes moving even more difficult. Another change that happens with osteoarthritis is the growth of bony bumps called osteophytes or bone spurs. These bony growths can form around the joint and physically block movement. Sometimes, you might even hear a grating or popping sound when you move the joint. Swelling and inflammation also play a role. When the joint becomes inflamed, it swells and can feel warm or tender. This swelling can physically limit how much you can move your joint and make movement painful. Proprioception, which is your body's sense of where your joints are in space, can also be affected by osteoarthritis. When proprioception is impaired, your coordination and balance can suffer, making joint movements less controlled and more difficult. Over time, all these factors combine to cause a gradual loss of joint function. You may find yourself struggling with everyday tasks like walking, climbing stairs, or even opening jars. In severe cases, the joint can become so stiff and damaged that it's almost impossible to use. Understanding how osteoarthritis impacts joint mobility highlights the importance of early management. Staying active, maintaining a healthy weight, and seeking treatment can help preserve your joint function. Keeping your muscles strong and flexible can slow down the progression of osteoarthritis and help you stay active and comfortable.